Dimenhydrinate is an antihistamine that helps to prevent and treat feelings of nausea, vomiting, and dizziness caused by motion sickness. It is important to note that this medication should not be given to children under the age of 2 unless specifically instructed by a doctor. For those experiencing motion sickness, dimenhydrinate can provide relief from the uncomfortable symptoms that often accompany travel. It is typically taken before embarking on a journey to help prevent motion sickness from occurring. The recommended dosage for adults is typically 50 to 100 mg every 4 to 6 hours, as needed. It is best to take this medication with a full glass of water and with food to help minimize any potential stomach upset. When planning to take a trip, it is best to take dimenhydrinate approximately 30 minutes before traveling to ensure that it has time to take effect. This can help to alleviate symptoms of motion sickness and allow for a more comfortable and enjoyable journey. Make sure to follow the instructions on the product package. If your doctor has prescribed this medication, take it as directed. If you have any questions, ask your doctor or pharmacist for clarification. You can take this medication by mouth with or without food. If it's a liquid form, use a special measuring device/spoon to measure the dose. Avoid using a household spoon as it may not give you the correct dose. Chewable tablets should be chewed thoroughly before swallowing. The dosage will depend on your age, medical condition, and how you respond to the treatment. Do not take more than directed or increase your dose. To prevent motion sickness, take the first dose 30 to 60 minutes before starting an activity that may cause motion sickness, such as travel. If you do not see any improvement in your condition or if it gets worse, make sure to inform your doctor. Some common side effects of motion sickness relief medication include drowsiness, constipation, blurred vision, and dry mouth/nose/throat. If these effects persist or worsen, it's important to notify your doctor or pharmacist. To relieve dry mouth, you can suck on sugarless hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. It's important to remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, it's important to contact your doctor right away if you experience any serious side effects, such as mental/mood changes, fast/irregular heartbeat, shaking, difficulty urinating, or seizures. Additionally, seek medical help immediately if you notice symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, it's important to contact your doctor or pharmacist. Remember to always consult your doctor for medical advice about side effects and to report any side effects to the appropriate medical authorities in your country. Before taking motion sickness relief, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions or other issues. It's important to discuss this with your pharmacist for more details. It's also crucial to inform your doctor or pharmacist about your medical history before using this medication. This includes any breathing problems, eye conditions, heart issues, high blood pressure, liver disease, seizures, stomach or intestine problems, an overactive thyroid, or difficulty urinating. Motion sickness relief may cause drowsiness or blurred vision. It's important to avoid alcohol or marijuana, as they can increase these effects. It's also advised to refrain from driving or using machinery until you can do so safely. If you are using marijuana, it's important to talk to your doctor about it. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are using liquid products or chewable tablets, it's important to note that they may contain sugar and/or aspartame. If you have diabetes, phenylketonuria, or any other condition that requires you to limit or avoid these substances, it's important to ask your doctor or pharmacist about using this product safely. It's also important to note that children may be more sensitive to the side effects of this medication, and it can often cause excitement in young children instead of drowsiness. Older adults may be more sensitive to the side effects of this medication, especially drowsiness, confusion, constipation, or trouble urinating. Drowsiness and confusion can increase the risk of falling. If you are pregnant, it's important to use this medication only when clearly needed and discuss the risks and benefits with your doctor. It's also important to consult your doctor before breastfeeding, as this medication can pass into breast milk and may have undesirable effects on a nursing infant. It's important to be aware of possible drug interactions with motion sickness relief. Some products that may interact with this medication include antihistamines applied to the skin, opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, and other antihistamines. Be sure to check the labels on all your medicines for ingredients that may cause drowsiness and talk to your pharmacist about using them safely. Additionally, motion sickness relief may interfere with certain lab tests, so make sure to inform lab personnel and your doctors that you are using this medication. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of overdose may include severe drowsiness, seizures, and widened pupils. In children, you may notice mental and mood changes like restlessness, irritability, or hallucinations before drowsiness sets in. Make sure to attend all your medical and lab appointments to monitor your progress and any side effects. This is especially important if you are using this medication for a long period of time. Your doctor may need to adjust your dosage or switch you to a different medication if you experience any adverse effects. If you forget to take a dose of motion sickness relief, just take it as soon as you remember. If it's almost time for your next dose, then just skip the missed one. Don't take 2 doses at once to make up for it. When it comes to motion sickness relief, it's important to store it at room temperature, away from moisture and light. Keep it out of the bathroom and do not freeze any liquid forms of the medication. And as with all medications, make sure to keep it out of reach of children and pets. When it comes time to get rid of any expired or no longer needed medication, don't just flush it down the toilet or pour it down the drain. Instead, consult your pharmacist or local waste disposal company for the proper way to discard it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.